Okay, so let's talk about central retinal vein occlusion and branch retinal vein occlusion. So we can see that we can talk about the central occlusion and the branch occlusion, and of course, the central retinal vein occlusion will be much worse in the consequences from the compared to the branch retinal vein occlusion, because the central retina is much bigger and much more influential than the branch retinal vein occlusion. So let's talk about the etiology. The major risk factors for central retinal vein occlusion or branch retinal vein occlusion are hypertension and age, but also other things like glaucoma, diabetes, and increased blood viscosity, and occasionally it is idiopathic. When we are talking about the symptoms, it usually present with uh, sudden painless vision loss. It can also be gradual, but usually it is a vision loss that is suddenly. What we can see in the using fundoscopy is many hemorrhages, and in the retina, as you can see here, there are many hemorrhages from the vein which was occluded. Sometimes you can see the veins which are engorged, tortuous. This is the things we can see, and also sometimes it's not here, but sometimes we can also see just focal hemorrhages, and you can guess that the more diffuse one, like you can see here, is related to a central occlusion, and the more focal one will be present in the branch type. Okay, so the diagnosis can be with all you can see here. OCT, sometimes you can see macular edema, so OCT can help here. Fundoscopy, as you saw, and also you can look for the risk factor like glaucoma and increased IOP, hypertension, diabetes, and viscosity of the blood, and so on. So for the treatment, you will mostly see anti-VEGF, sometimes steroids, and sometimes lasers for edema, and laser for neovascularization. So anti-VEGF is the main course of treatment, and steroids are the main course of treatment. Laser photocoagulation for branch retinal vein occlusion, macular edema, but it's less effective than anti-VEGF. And if there is a neovascularization, a photocoagulation, pan-retinal photocoagulation may be an option. The purpose is to decrease the hemorrhages and prevent neovascularization that will cause a glaucoma. So this is about central retinal vein occlusion and branch retinal vein occlusion from Make Manual Professional Edition. Thank you. If there are any mistakes, please correct me. And sorry, and that's it.